Okay, everybody, welcome to Inside PA Training. This is Paul. I got a request for a student interview, and I actually just happen to have one here with me at my clinic. His name is Josh. So, Josh, a couple questions. Welcome.
Thanks.
Thank you. Tell us a little bit about where are you in school, time-wise and place-wise?
Well, my school requires, probably like most schools, 9 clinical rotations. I'm at the end of my 9th clinical rotation, so I'm about a week away from graduating from PA school. I go to Southeastern University in Florida.
Okay. And how did you wind up here, or out here from Florida? We're in California, for those who don't know.
Right. I'm originally from California, went to school out in Florida for a variety of reasons, and part of the program is you can do your last 3 rotations anywhere you'd like, as long as you can set up the insurance, paperwork, and things like that. And so, since I'm originally from here and like living here, I came back.
You knew you were going to be heading out this way anyway.
Yep.
Awesome.
Mm-hmm.
All right. So you're graduating soon. How does that feel?
Very exciting. It's been 27 months, and I'm looking forward to being done and actually making some money.
Good. Good.
Mm-hmm.
So for those who don't know, you're working now, or you're finishing up at our urgent care clinic here. We also do primary care. How has that experience been for you?
Urgent care and primary care, I think, are very challenging because you have such a variety of things. The one problem you're not going to run into is getting bored, because you have to be a jack of all trades. It's never-ending learning as far as the variety of things that you see. It's fun. I like it. It's challenging. I have to look things up a lot, read on things, refresh my memory all the time.
Absolutely, yeah. And then remind me, did you say what rotations you had done already?
Yeah, I did all the core rotations that you normally have to do. Emergency medicine, pediatrics, family medicine, internal medicine, things like that.
OBGYN?
I did not do an OBGYN.
Okay. And do they have you do geriatrics?
No, that was an option of something we could choose to do, but I don't really think it's up my alley.
Yeah, some schools have elective rotations. You knew that was probably not going to be your area, so.
Right.
All right.
Right.
What have you enjoyed the most so far?
The most? Probably urgent care and emergency medicine. A lot of hands-on things are a lot of fun for me.
Okay.
Yeah.
What's the coolest thing you've seen? I'll put you on the spot here. I didn't warn you I would ask this question,
but. No, that's okay. Gunshot wounds. Femur.
Did you really?
Yeah, femur fractures from high falls.
Okay.
Just major trauma was pretty cool.
What emergency room were you in?
I was at Adventura Hospital in South Florida.
Okay. Is that a trauma center, do you know?
It's not.
It's not, okay.
No.
So you saw a gunshot and a
Yeah.
fractured femur and no trauma center. So
Right.
that gives you an idea, like if you're working at a trauma center, you're going to see even more than that.
Even more than that.
All right. And as you know, Josh, a lot of people who will be watching this are considering becoming PAs.
Right.
And it helps them to learn a little bit about what's involved. I mean, how did you decide you wanted to be a PA? How did that happen for you?
It was a long road. I was in the pre-med track in college. Then
I'm sorry, how old are you now?
I'm 29.
29, okay.
In college, I was pre-med, and then I fell out of it and thought I didn't want to do it. I'm pretty science-minded. I got into working in a lab, a biomedical lab, doing some work like that. And then I realized that I'd rather work with patients, and I didn't want to go the MD or DO route. And then I found out about PA.
Why did that not appeal to you or work for you?
A couple things. The length of schooling, my age, where I was at, and PAs do so much of what I wanted to do when I fantasized about being an MD or DO. PA pretty much fits all those things that I wanted to do. And so it seemed like a good fit for me in that way.
And now, in retrospect, now that you're several years down the line, has it continued to feel that way? Like you're doing as much of that kind of work as you want to do?
Yes, still happy I picked it.
Awesome.
Yep.
All right. Let's see. We talked about how you got here, what your interests were. What was it like being a student?
Sometimes, it is a little difficult. Some preceptors are more kind than others, more trusting than others, And sometimes you get walked on a little bit, or
So
if there's a problem in the clinic, you're the perfect person to blame as the culprit. And so you have to take your lumps a little bit.
Were these physician or physician assistant preceptors?
Mostly physicians who were my poorer or less enjoyable preceptors.
Oh, really?
Were the physicians. Every time it was a physician assistant. There was great connection, there was good energy, they were always kind, they let me do a little bit more.
Okay.
Really helped me get my feet wet, because I bet they had the same experiences that I had, and they wanted to treat me probably better than they were treated.
I see. So they're a little more empathic about it.
I feel like that, yeah.
So I guess I was wondering, in your supervision with preceptors, did you feel like the doctors that you worked with, the physicians, understood the role of PAs and were okay with it? Did you get any pushback there?
I feel like all the doctors who were willing to take a PA student on understood.
And most of them already had before?
Most of them already had before. All of them that I had had done it before.
Okay.
And many of them had PAs working for them at the time. So they did understand the role, the profession, etc. I didn't have any problems with that.
Yeah. So you mentioned about taking your lumps. Can you say a little more about that? I think people would be curious.
Yeah, just little things like.
Did you get pimped?
A couple times by a few preceptors. Yeah.
So pimping, for people who don't know, is where a preceptor hits you up with some questions they expect you to know or they want you to learn, and they usually put a little pressure on you, like, hey, what's the answer to this? Quick.
Exactly. And if you don't know, their favorite thing to hear from you is, I don't know. They don't like it when you sit there and try to make stuff up. They hate it. And so you say, I don't know, then it's expected of you socially and how this interaction works to go home and study it. And if they ask you the next day, you have to know it. And if you don't, you're going to get a really poor review.
And did you feel like that was a learning experience that was helpful to you?
Oh, yeah. In fact, I like getting those rotations where I get pimped a lot.
Okay.
Because it motivates me. It keeps me on my toes. I feel like I'm learning all the time.
Yeah, awesome. Okay. So then I guess the other thing that I always hope that the people who watch these videos take away is a sense for what would be helpful to them. Do you have any words of advice for people who are pre-PAs or even just looking into this field? What would you suggest to them?
The generic answer, I guess, is shadow a PA.
Okay.
See what they do. And
You
don't
did some of that?
I did. Yeah, I shadowed in urgent care, actually.
Okay.
Down in Fremont, and I really liked it. Don't just shadow in one person in one place, because this profession is so varied in what we do and where we go. So check a couple different places out.
How much time did you spend shadowing altogether?
Just about a month.
And that was, what, 5 days a week or 1 day a week?
It was about two days a week.
2 days a week, so like 16 hours a week for a month.
Yeah.
That's actually a fair amount of shadowing.
Yeah.
We do get people who ask us how much shadowing should you do, and I tell them at the very minimum 1 day. And that's to make sure that you know what you're getting yourself into.
Right.
But more to get more familiar with the role of PA and the interaction with their supervising doctor, and medicine to a certain extent.
Another thing, from what I hear from the classes under me, talking to them, is that the requirements for GPA is climbing up. The people are finding out about PA and realizing that it's a great career, it's good money, it's interesting, it's fun. You don't have to have tons and tons of schooling like MD and DO to make it happen. And so I think more and more people are coming into the profession, and so it's getting a little tighter on who gets in and who doesn't. Yeah. So work on those grades.
Were in your class?
We started off with 77.
That's a big class.
And we got down to 70 after about 8 months.
Okay. The
stress and rigor of the program just caused people to say, it's not worth it, I'm out. Or they failed out.
Okay. So you wouldn't, a lot of people wonder if PA school is easy. I don't think you're saying that. Yeah.
It's not easy
I don't
at all.
anybody say that.
I mean, I don't know about your experience, but mine was, I had to push really hard.
Oh yeah.
It was very, very difficult.
Yeah. It was very intense for me too, and a lot of lost sleep and, interpersonal stress that went with it for me too.
Oh yeah.
So how about people who are interested in getting in this field, they've done some shadowing, they know this is what they want to do. Do you have any advice for how to go about preparing for application to PA school?
Yeah, get all your prerequisites done. You can go to your blog, find out how to write a good essay to get into PA school.
I did not pay you to say that.
No, you didn't. I know. I'm just saying, like,
but yeah.
I went to similar, resources like that for writing good essays, things like that. Get as much shadowing as you can. PA schools really like it if you have had a job in the medical field before.
Yeah.
And if you go to certain websites, you can see that they categorize the job experience that you've had. For example, I was a CNA, but if I was in ENT, that would have been a better thing to put on my resume and applying to PA school than CNA, because you do more, you're more trained, you're closer in your skill set to PA than CNA.
How much time have you spent as a CNA when you applied?
Very little. Just
Really?
a few months, actually.
Wow, I'm surprised.
I pretty much went to CNA school just to be a stronger applicant for PA school.
Okay.
That's the only reason I really went.
Well, people do ask that, absolutely. And we do have an article that I did on what are the best forms of healthcare experience, and yeah, I think EMT was pretty high on the list.
Yeah.
Paramedic, that sort of thing. But
Exactly.
for some people, that's not an option, and CNA is an option. So.
Right, and so it did benefit me.
Yeah. What were some of the other prior experiences students in your class had had?
Oh, a lot. You name it. A lot of MAs.
Medical assistants.
EMTs. People worked as nurses.
Okay.
And those people were very well prepared.
Okay. How about things like phlebotomy and
a couple people.
So the ones that have less patient interaction.
Yeah, a couple people
Okay.
did phlebotomy
So it
in the
happens.
past.
But obviously, you're a stronger candidate if you have more time with patients.
Yeah.
Okay, great. Any parting words? Like, if you had to grab somebody by the shoulders and tell them one thing before they go into this field, what would you tell them?
Ask a lot of questions. Know what you're getting into. It's a great field.
Like, do your research kind of thing?
Yeah, do your research, because I feel like a lot of people in my class, they didn't really know, what they were getting into, and just said forget about it, and $10,000-$20,000 later left.
Wow.
Yeah.
Wow, okay. So there's some financial commitment too, obviously.
Oh, yeah, definitely, yeah.
All right. Hey, Josh, thank you so much for talking to us. I really appreciate it.
No problem.
Good luck on your graduation.
Thanks.